Morning, everyone. All right, it is 8:31, so figure we should get this rolling for the day. My name is Jackie. I am with Two Rivers Public Health Department. I am the nursing section manager. So I will be presenting today. So let's get going. Our first slide just shows a picture, a pretty picture of a Fort Kearny Lake. Next, just a reminder of who we oversee. So this is our district. So we have 7 counties. Our population is 97,519. And we oversee Buffalo, Dawson, Phelps, Kearny, Harlan, Franklin, and Gosper counties. A reminder for our mission and vision. So basically the best thing you need to know is we are here for healthier communities for all. This is our nursing team. And so this just shows you all of our nursing teams. So I am in the left upper corner, Jackie Haley. We have Marilyn, our program nurse, Liz Weens, our community health nurse, Rosa Pinion, our program nurse, Rita Call, a community health nurse, and Jordan Anderson, a community health nurse. Just like to put faces, the names for you guys. Okay, so rather than reporting on COVID and flu, thank goodness we're out of that season. We will be covering what's circulating in our area at the time of the surveillance call. So in about this time, it's really popular for people to come down with Salmonella infection. So in the Two Rivers district, in March, we had 4 cases that we investigated. April, we had 2. May, we had 1. And June, so far, we've had 1. So that was updated last night. So first off, we're just going to go over what is Salmonella. So Salmonella is an infection or by salmonellosis. It's common bacterial disease that affects the intestinal tract. Salmonella bacteria typically live in animal and human intestines and are shed through stool or feces. So humans become infected when through contaminated food or water. So signs and symptoms. Some people with Salmonella infection have absolutely no symptoms at all. Most people develop fever, diarrhea, and stomach or abdominal cramps within 8 to 72 hours after exposure. And most healthy people will recover within a few days. So possible other signs and symptoms. So we have diarrhea, stomach cramps, fever, nausea, vomiting, chills, headache, blood in the stool. And like I was saying a little earlier, generally symptoms last a few days, but they could last up to 10 days. So causes. Salmonella bacteria live in the intestines of people and animals and birds. So most people are infected with Salmonella by consuming food or water that's been contaminated by these species. So the most commonly infected foods would be raw meat, poultry and seafood, raw or undercooked eggs, unpasteurized dairy products, fruits and vegetables. And fruits and vegetables, they get contaminated through water. Or cross-contamination while you're in the kitchen. So we watch a lot of different things. Not only do we watch the cases that we get that come over the queue and then do disease investigations on them, but we also get notified by the FDA and CDC if there's outbreaks. So in May of 2023, there was an outbreak investigation of Salmonella due to raw cookie dough. So I kind of linked everything for you guys here. So when I send out the slides for you guys can actually go in and you can read all about this. And they're actually very interesting. We had 3 different kind of outbreaks right within the seasons. And so it's the cookie outbreak, flour, and then poultry. So this cookie outbreak The product was Papa Murphy's Take and Bake, raw chocolate chip cookie dough, and s'mores bar dough. So this is an ongoing investigation. The stores affected were Papa Murphy stores nationwide. The recommendation is to not eat, sell, or serve the Papa Murphy's chocolate chip cookie and s'mores bar dough. And then the raw dough safety tips they give you. So basically, don't eat raw cookie dough, is really what it comes down to. So case counts for this outbreak. We had a total illnesses so far of 18, of which 2 have been hospitalized and 0 deaths. So the other good thing that CDC does is they will provide maps of where these outbreaks are. They also provide information. So if we can connect, or you guys can connect a salmonella infection with this Papa Murphy's raw cookie dough, we can go in there and we can link it. That way it gets associated with this outbreak. So the map that you see, it's providing the case counts per state of where we have found this salmonella outbreak due to these particular cookies. So there's lots of information. Like I said, I did provide the link up the top. And so when you guys get the slides, you guys can actually go in there and you can look at everything and, review everything. It's actually quite interesting. Next up for salmonella, which is probably most important in Nebraska, is salmonella in poultry. So we usually do have outbreaks within poultry within Nebraska. So the reason we have this is chicken and ducks can carry salmonella germs even if they look healthy and clean. So these germs can easily spread to anything in the area where the poultry live and roam. So you can get sick from touching your backyard poultry or anything in their environment, and then touching your mouth or food and swallowing the salmonella germs. So basic how to stay safe with poultry. So wash your hands. If you do not have water and soap available, you can use hand sanitizer. And just remember with hand sanitizer that it's not the actual sanitizer that you put on your hand that is killing everything. It's the rubbing and the friction of your hands going back and forth and rubbing those germs and popping them, right? Don't kiss, snuggle, or eat and drink around your backyard poultry. Keep food and supplies for backyard poultry outside your house. So there are some people that they have like a little mud room, and sometimes they'll keep like food or, supplies for their animals just right in that mud room. And you really want to keep that separate from where you guys live. So the recommendation is to keep that out in a barn or a coop, but that way you're not having those possible salmonella germs right there in your house where, you can track them in or pick it up really easily. Supervise your kids around the flocks. So, and this is just particular because kids are really bad about, picking them up and loving them and kissing them and then not washing their hands. So supervise your kids, make sure if they are picking up any of your poultry that you guys are doing hand washing. And then also handle eggs safely. So collect your eggs often, throw away cracked eggs, rub off the dirt with fine sandpaper. You're actually not supposed to wash eggs like from home because that can actually cause more problems with your eggs. So the recommendation is to rub off the dirt with fine sandpaper and then refrigerate your eggs to keep them fresh. And then once you do cook them, make sure you cook those eggs to 160 degrees. And that basically is where both the yolk and the other part of the egg that I can't think of right now, get hard enough that it will kill that salmonella. So once again, CDC has great infographics. I loved this little chicken. It says, don't play chicken with your health. And it just gives you some fun, well, I guess, interesting facts about salmonella. So since 2000, 70 salmonella outbreaks have been linked to backyard poultry. So once again, like I said, it really is something that we have to think about in Nebraska. And the reminder at the bottom is wash your hands after handling backyard poultry. And then we also have the other infographic of the states. And so this one is a little bit more broad because it's not your defined outbreak like in the cookies. So this one is, poultry we have kind of everywhere. So this one shows us the number of sick people per state. So Nebraska is that kind of light green, which is number of sick people 1 to 3. I think that's like per capita, but anyways, what I wanted to really show you guys was they really do have some interesting infographics and information for you guys. And you can kind of see where some major outbreaks are happening. So next up, we have our CDC HON Health Advisory. So we do get these quite often. You can sign up for these. So they will come automatically into your guys's emails. So this HON just come out, I believe it was right the end of May. But this is an outbreak of fungal meningitis in the US with patients who underwent surgical procedures under epidural anesthesia in Matamoros, Mexico. So these HONs, they are really important for us clinicians because it kind of gives us, a background to if people are coming in with some interesting things, we can hopefully try and connect them. So for this one, the most important thing that we need to know is that healthcare providers and the public should be aware that patients who underwent medical or surgical procedures under epidural anesthesia in Matamoros, Mexico, and have developed signs and symptoms of possible meningitis, they should probably seek evaluation by a healthcare provider. But it's also good for us as healthcare providers to know that this is going on. So if we do have somebody that comes in and is having signs and symptoms of fungal meningitis, that we can get them tested, and if they have had any contact with this Mexico and epidurals and whatnot, then we can go ahead and we can associate it and notify. And so that it will be, all together, and they will be counted as a case. So it's great for you guys to know. That way you guys can be asking your patients. Also, it just kind of goes over signs and symptoms, and we don't see a lot of fungal meningitis in the United States. So it's a really good reminder for us all. So fungal meningitis signs and symptoms could be fever, headache, stiff neck, nausea, vomiting, light sensitivity, and confusion. It can take weeks for fungal meningitis symptoms to develop, and they may be mild at first, but once they start, they quickly become severe and life-threatening. So, as we all know, meningitis is not a fun thing. So, with this one, just a little background on it. They found a lot of patients within Texas that underwent cosmetic procedures. And as of May of 2023, 5 patients had been diagnosed and suspected with the fungal meningitis. All had been hospitalized and 1 had died. So that's just a little backstory. Once again, I did link this for you guys, the emergency HON. So when you guys do get the PowerPoint, you can click on that and you can go and read all about it. But like I said, if you are interested, you can also go on to the CDC HON Health Advisory and you can sign up for those emails. All right. So next thing we're going to talk about is Marburg virus. So in May of 2023, we had 2 Marburg virus outbreaks that WHO and the CDC were monitoring in Africa. So that was within Tanzania and Equatorial Guinea. When the WHO or CDC are monitoring outbreaks, Two Rivers is notified of travelers that had the potential for exposure, or we would be notified if somebody would have a positive Marburg virus lab within our district. So Two Rivers would then complete a disease investigation, and if found to be high risk, or if they actually had a positive lab, then we would monitor these individuals. We would do a full disease investigation, figure out who they have contact with, who we need to call, how big or how small this problem could be. So we did have 4 travelers it was right at the end of May. And so that's why this really sparked me for starting this information on Marburg virus. So we did have 4 travelers. And after we did a disease investigation on them, we found that they had absolutely no contact. They just were travelers that were over in Africa, but they were not anywhere near Tanzania or Equatorial Guinea. So they were low risk. So we did not have to do really anything else with them. We did educate them. So we educated them on signs and symptoms, and then what they need to do if they would get any signs and symptoms, and who to call. And we gave them like our personal work cell numbers so they could call us back as well. Also just calling us if they would have any questions. Fortunately for us, as of June 2nd, WHO declared the end of Marburg virus outbreak in Tanzania. And then as of June 8th, WHO declared the end of the Marburg virus outbreak in Equatorial Guinea. So that's wonderful. So what that means is we're no longer going to be watching travelers or being on high alert for anybody. It doesn't mean that we couldn't have Marburg virus, but the chances are pretty low, very low. So I just kind of want to go over with you guys because, these new diseases, I don't know a ton about. And so I think it's just interesting learning about each and every one. So Marburg virus, so what is it? So it is a serious and very contagious disease caused by the Marburg virus. And up to 9 out of 10 people infected with Marburg virus will die without treatment. So the chances of survival improve when treatment is given early and at a treatment center. So that first little picture, that's an actual picture of the Marburg virus. So how does the Marburg virus spread? So the virus spreads when a person is in contact with body fluids of someone who is sick with or has died from Marburg's. So I had fun with this. I made this, it's kind of a long infographic. I kind of cut it up into 2 slides for you guys, so it just makes it more palatable. But I will send this out for you guys as well, so you can put it up. I know that outbreaks are over and whatnot, but it's still really good information for our healthcare providers. So it can be found in saliva, sweat, urine, amniotic fluid, vomit, diarrhea, blood, semen, and breast milk. So what are the signs and symptoms to look for? So on the left side, you can see there is an early and then an arrow down to later. So we have early symptoms, and then as we go down further, those are our later symptoms. So we can have fever, loss of appetite, weakness, headache, muscle joint pain. That's kind of early. Then middle is kind of about sore eyes, sore throat, a rash, stomach pain, some diarrhea. And then later symptoms would be vomit, bloody nose or gums, bloody vomit, or bloody diarrhea. So the main takeaway of this is, what should you do if you know someone with signs and symptoms of Marburg? So 1, we need to act quickly, because like I said in the first slide up here, the quicker you act, the better off they are, because hopefully we can get them to survive. So act quickly and then notify Two Rivers immediately. So like I kind of said at the beginning, Two Rivers is notified for travelers, positive lab results. If you guys have an inkling that it could be go ahead and give us a call. And then we complete disease investigation and risk assessment, figure out if they're high or low risk. If, you know, you guys are seeing them in clinic and whatnot, we are going to get everybody on board with DHHS and figure out a good treatment plan and get you guys everything that you guys need. So yeah, so I also linked on this infographic the CDC information, so you can go on, you can read all about Marburg. It is quite interesting. So next we got Beach Watch. Okay, so it is that time of the year again where we're actively watching our beaches for high bacteria levels. So if you haven't subscribed to Beach Watch, I would highly recommend. At the bottom left corner, it has how you can subscribe. So you go to the listserv and you email them and you put your name, and then they will add you to the notification. So when they send notifications, the top left is kind of an example of what they send. And they do send pictures, and they do send like kind of educate you on what they're doing and why they're doing it type thing. So it actually is very neat. But last week we did get notified that we had Fort Kearny Lake #1 that was high for E. coli bacteria. The picture I don't believe is E. coli. I believe it is the other one that they usually look at. But I just thought it was, they generally send you pictures, that way you can see, and it just creates awareness. That way when you see things like this out and about, you're like, I'm not going to go in that lake. So anyway, so we did have Fort Kearny Lake #1 that was high for E. coli last week. We did do a push out of education on that on Facebook. So that's what our right picture is. So the Fort Kearny Lake test positive for E. coli. So when we get anything within our district, we will send this out and we will notify everyone. That way everybody is aware. And this is just to make sure everybody is safe. We also tie Beach Watch back into our disease investigations. So knowing that we have a lake high with E. coli bacteria, if we get somebody that comes across the queue with a positive lab for E. coli, then we automatically say, have you been in a lake? You know, have you been to Fort Kearny Lake? Just knowing that information. So it really is very good information for clinicians to know, especially in our district, because it really can hone in and give you guys more insights. So like I said, if you haven't subscribed to that, it really is very interesting, and you can watch it through the summer. So it's just very interesting. It really is. Oops. Oh, I don't know what happened there. I lost my slide completely. Hold on. I don't know what happened there.
While you're navigating, I can mention too, for those of you who are on, we generally predict or tell you about our COVID numbers. Between Jackie and I, this is Katie Mulligan, sorry about that. Between Jackie and I, we're gonna plan on starting to present COVID numbers kind of around the same time we present flu numbers, unless we see an unusual spike in cases, and then we'll let you know. But we're gonna try and hopefully make this call as useful for you as possible. And I'd welcome any feedback. I'm sure Jackie would welcome any feedback. We want this to be something that you both enjoy listening to and find very useful. Back to you, Jackie.
Yeah, thanks, Katie. I don't know what happened with my screen, but it stopped sharing at the very last slide, which is very frustrating. But I have cute little pictures that I need to show you guys. So this is Katie, who was just talking. This is her two little cuties, Maddie and Miles. And they were actually out at Fort Kearny Lake fishing and having a good old time. So you can see Mr. Miles with this little fish, and Then Maddie with her little turtle, which, you know, that little turtle could have salmonella. So I'm pretty sure that Katie had Miss Maddie washing her hands after that. So that is all I have for today. And like Katie said, we're really trying to make this so it is worth your guys' time. So if you guys have any suggestions and would like us to cover something or clear something up, please give me email back. I will send out to you guys today the email that will have the YouTube link so you can have other people watch this if you'd like. And then I will also send out the PowerPoint slides, and I will send out my infographic on Marburg virus as well. So all things that you guys can use, but like I said, you can always reply back to that. I make it so the email goes out, and if you guys do reply, it just replies back to the Two Rivers people. But if there is any information that you guys would like to know, we would be happy to share any information we can find with you. So, do we have any questions or comments? If not, then I will go ahead and give you guys your lives back and you can get back to your busy lives. So like I said, if you have any questions or would like us to cover anything, just let me know. Thanks.